There is no doubt that the United States healthcare system needs serious reform. While some countries have declared healthcare a right, the United States still refers to it as a privilege. Thousands of Americans have gone bankrupt due to the medical debt in the past 10 years, even though 75% of them had health insurance. Their insurance lacked adequate financial protection from healthcare costs, along with opaque billing practices, and patients usually do not realize what they are being charged until the bill arrives. All of this could be avoided if universal health care was implemented in the United States. Coupled with cost controls such as administrative simplification to make costs clearer, and measures targeting service providers and medical suppliers to make a large profit from drug prices, universal health care could save patients money while expanding access to everyone in the country. Universal health care can provide insurance plans for small businesses, covering employers, employees, and even people who are self-employed. Universal health care could also cover people in the funding gap who struggle with being able to afford health insurance otherwise.
Morning, Miranda.
Morning, Dr. Lambert.
Have anything for me?
Just the usual bill, sir.
You know very well most of these patients can't afford this. Are you sure we can lower the price any further?
Sorry, Dr. Lambert. There's nothing else we can do. It's not up to us.
As if these people weren't suffering enough. Mrs. Foster?
Please, doctor.
I'm so sorry. Mr. Krieger? Mr. Brenner? Poor guy. Here's your bill, Mr. Twist.
Oh God, Doc, I can't afford this.
I'm sorry, Charles. There's nothing I can do.
Doctor, please! I'm still in debt from my last visit.
I wish I could help you, Mr. Twist. You should try contacting your insurance company.
I'd rather feed my kids, Doc. Oh no. This is bad.
3 months later, the young Charles Twist died of his illness. He will be remembered as a loving father and husband. After his death, his family was burdened with paying the bills that their insurance company refused to cover. As a form of protest, they nailed the bills to his tombstone. Could this have been different? Could Charles have lived a long and happy life? What if the patients of this hospital had universal health care? What would that have been like?
Good morning, Miranda.
Morning, Dr. Lambert. You're very peppy this morning. You okay?
I'm just happy about the change in administration and how the new reforms are going to benefit our patients. Speaking of patients, I have bills to hand out. Have a great day. Good morning, Mr. Twist.
Doctor, I have to tell you something. The bill? I'm not quite sure I can afford it.
Don't worry about it. You're covered.
What?
Yeah, you have universal health care, and therefore you don't have to worry about a thing.
Oh, Doc, thanks. Thank you very much.
I'm glad I can help. Send my best to your family.
I will, Doctor. Thanks. Thanks again. God, I love having universal health care.
Charles Twist lived a long and happy life with his loving wife and 3 children. Today, he celebrates his 101st birthday. Just look at that smile. I'm sure he's glad he had universal health care when he needed it most.